So now, the goal of screening is to reduce morbidity or mortality. We'll see that ideally you should have data on mortality, showing that screening individuals, screening groups, reduce mortality. And you will rely on the early diagnosis and early treatment of the disease to reduce the mortality. What is really important is to realize that screening doesn't prevent the disease. There may be one exception with colorectal cancer screening, in which you can prevent the disease to appear because you would, for example, remove a polyp that may eventually progress to a cancer lesion. But in general, screening is not about reducing the incidence, the new cases of disease. It's about having a better outcome, prognostic of the disease by a better and earlier treatment. Screening actually has two major components, diagnostic and therapeutic. There is no screening with only one component. You have to have both, to diagnose the disease and then to treat. As you can see on this slide, we try to summarize that, and basically you have two large boxes. On the far right side you would have the diagnostic part, and on the left side the therapeutic component of screening. But screening is this whole big box, and inside you will have the test, the screening test, that will categorize people at high risk of disease or low risk of disease. I would say high probability of disease and low probability of disease, positive, negative. Then the positive individuals will receive a diagnostic test. The diagnostic test has better performance than the screening test. By definition, it has to put a diagnosis on the disease. The first one, the screening test, just had to put a probability of having the disease. And then with the diagnostic test, you will have individuals with the disease, without the disease, and subject with the disease would have received an effective treatment. So screening is really the mixture of the two components. In screening, you have to understand some basics concepts that we will describe right now. Screening is taking advantage of what we call the preclinical phase of the disease. Basically, it means that before the disease is clinically relevant, which means that you feel pain, fatigue, or you see signs like cutaneous lesion, or you have fractures on the bones, you have a time where the disease progresses or is progressing, but without any sign or symptoms. Screening will take advantage of this time, which we call preclinical phase, and to understand or to identify how likely you have to catch the disease in this phase, you have to understand the natural history of the disease, and we'll now discuss in the next few minutes the natural history of disease.